Good afternoon, everyone, and welcome to the COVID-19 update for Wednesday, November the 18th. The last 2 days, I've showed you the severity of the situation in our hospitals, which currently are averaging 5,561 patients in the hospital battling COVID-19, 739 more than the highest average that we ever saw last spring. I've shown you how the rate of increase in hospitalizations, as well as our case numbers, has hastened from a linear rate to now an exponential rate of growth. And I've shown you the disturbing hospital capacity issues that Illinois-specific modeling indicates that we could have without intervention. That's a problem for all of us, because it's not just COVID-19 patients who need hospital beds and the expert care of doctors and nurses. Cancer patients, those injured in car accidents, expectant mothers, victims of heart attacks and strokes. When we let our hospitals get overrun or even close to it, it is all of us who suffer. Whether because of conspiracy theories, right-wing political ideology, or naivete, too many people still seem to think that COVID-19 is a hoax, or that a disease that is killing 1,500 Americans per day and 1,500 Americans per day and rising isn't worth any effort to stop. Remember last spring when hospital workers were lauded with gifts of free pizza and cheers at the grocery stores and pots and pans banging in unison at 8 o'clock at night? Well, hospital leaders tell me that that's all come to a grinding halt. Now, healthcare workers are experiencing verbal assaults by people who come to the hospital suffering from COVID-19. Since last spring, the divisive and misleading rhetoric of the outgoing President of the United States seems to have implanted a false narrative in the minds of a loud minority of Illinoisans. Doctors and nurses tell me that some people who come into emergency rooms with COVID, sometimes struggling to breathe, are screaming at hospital workers about how the disease is a political hoax or some sort of hospital profit scheme. It's beyond tragic for all involved, and the accusations and strange notions are just not true. All of their false narrative has been proven untrue. I'm most concerned at the moment for our healthcare heroes who take the brunt of this and seem to have been forgotten by the good people who cared about them so visibly last spring. Nurses and nurses' assistants are once again pulling double shifts. Respiratory therapists are back to working increasingly long hours to keep people alive in the ICU. Doctors are donning and doffing PPE all day and all night. Janitors and cafeteria workers, who get paid the least, still come to work in a dangerous environment day in and day out. Just like police and firefighters, our healthcare workers risk their lives each day, walking into the face of danger. They still deserve to be hailed as heroes. So if you know a hospital or a healthcare worker, find a way to do something special for them. Or even just say thank you when you see them on the street or in your neighborhood. Each of them are just as much the hero today as they were last spring. COVID-19 is now the third leading cause of death in Illinois, behind heart disease and cancer. Not only that, between March and October, COVID-19 took more lives than the next two highest causes, strokes and accidents, combined. The bulk of COVID-19's impact on the people of our state came, as you would expect, between March and June of this year. Over the summer, as cases, positivity rates, hospitalizations fell, so too did deaths from COVID-19. Unfortunately, the virus is back with a vengeance. There's a significant increase in the number of people losing their lives to COVID-19 amidst this current surge. In August, we were losing on average 14 people per day to this horrible disease. Today, that number is 83. As of today, we've lost 11,014 Illinoisans to this virus, more than 1,000 people in the last 2 weeks alone. That includes 140 reported in just the last 24 hours. Another 140 sets of families and friends searching for a way to grieve in this terrible trap. And the same disease that stole their loved one's life from them now won't allow them to gather with all who grieve with them. To all who have lost someone this year, please know that the good people of Illinois grieve with you. May the memories of all that we've lost be for a blessing. Early on in this pandemic, it would be forgivable to think of COVID-19 as only a problem for the nation's denser and more globally connected cities. But as we've been saying all along, this virus knows no boundaries and has never given much thought to county lines. That's become exceptionally clear this fall, as our rural and small-town counties are seeing a per capita death rate twice that of our highly populated counties. This is the trend that's being mirrored all across the country. Broken out even further, we are seeing national death rates in rural counties that are more than 3 times as high as the nation's largest metros. I want to bring this conversation back to this slide, because at the end of the day, with all the grief that our state has endured with the loss of life, we still have a chance to prevent more of it. Models project that without additional mitigations, daily COVID-19 deaths would at least match the previous spring wave and could even rise up to 4 to 5 times that level, a risk that grows as hospitals become increasingly filled by more patients and as more of our heroic healthcare workers get sick, leading to staffing shortages. Without new interventions, projections show that between 17,000 and 45,000 additional deaths in Illinois would occur between now and March 1st of 2021. We can't let that happen, and we already know exactly how to save thousands of lives. Stay home when you can. Avoid gathering. Wear a mask. Keep your distance. Get your flu shot. Every day that we take action to stop the spread is another day that we give to scientists and doctors to figure out new and better treatments, new technologies, and new vaccines. Just today, we saw another step forward with the FDA emergency use authorization of the first at-home COVID-19 test, which bodes well for even more and better testing down the line. We can get through this. We know how. So let's use the tools that we have, and remember, the best way through this is working together. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike.
Good afternoon. I still hear people saying that COVID-19 isn't real, that it's just another cold, or that it's a conspiracy. The bottom line is that COVID-19 is real, and it is worse than a typical cold. This not real virus is overwhelming our hospitals. Right now, it's taking up 1 out of every 4 beds that's occupied in the hospitals across our state. This just another cold is putting hundreds of people in the ICU and on ventilators. It's estimated that influenza causes between 12,000 and 61,000 deaths annually in the US. But in this year alone, we have more than 246,000 deaths that are attributable to COVID-19. We have to call out the untruths. We have to speak truth. COVID-19 is very real, and it has been very deadly for so many. Since yesterday, we've received reports of 140 additional brothers and sisters and coworkers and grandparents who have lost their lives to this not real virus, for a total of over 11,000 lives lost. Today, we are reporting 8,922 new cases for a total of 606,771 total cases. Overnight, 5,953 individuals were in the hospital with this not real virus. 1,146 of those were in the ICU and 547 were on ventilators. I'm also hearing people say that it's only older people or those with health conditions who are dying from the virus. Well, it is true that people who are older and people who have comorbidities are at higher risk, but I will tell you that of the 140 new reports of deaths that we've gotten, 2 of them were in their 30s, 3 were in their 40s, 9 were in their 50s. The populations at greater risk are our elderly, but I believe that the death of a 90-year-old or a 50-year-old or a 20-year-old all matter. If people want to bury their heads in the sand and pretend that this virus doesn't exist or it's not that bad, I guess they're free to do so. What you should not be able to do is risk the health of other individuals and everyone that you come in contact with because you won't wear a mask, or because you won't stop hosting or going to events and gatherings, or because you won't socially distance. You don't have the right to expose another person to a potentially deadly virus. So even if you can't see how real this virus truly is, can we at least agree to be respectful of others and wear a mask and keep our distance? Everyone's actions affect others. And remember, if you really want to give thanks this Thanksgiving, give the gift of life and not put someone's life in danger. Buenas tardes a todos. Todavía escucho a la gente decir que COVID-19 no es real, que es solo un resfriado o es que es una conspiración. En realidad, COVID-19 es real y es peor que un resfriado típico. Este virus no real está llenando nuestros hospitales. Este solo otro resfriado está poniendo más de 1,000 de personas en el hospital y en la unidad de cuidados intensivos y en ventiladores. Se estima que la gripe causa entre 12,000 y 61,000 muertes al año en nuestro país. Pero desde el 21 de enero de este año se han reportado más de 246,000 muertes por COVID-19 en los Estados Unidos. He escuchado a personas decir que solo las personas mayores o las personas con problemas de salud mueren a causa del virus. La verdad es que personas de todas las edades han muerto. También la verdad es que las personas mayores o las personas con problemas de salud corren un mayor riesgo de enfermedad grave y muerte. Pero eso no significa que esas vidas no son importantes. La muerte de una persona de 90 años, una persona de 50 años, una persona de 20 años, todas son personas de igual valor. Desde ayer ha reportado que 140 personas más han perdido la vida a causa de este virus, por un total de más de 11,000 vidas perdidas en Illinois. Hoy estamos reportando 8,922 casos nuevos para un total de más de 600,000 casos. 5,953 personas estuvieron en el hospital en las últimas 24 horas. 1,146 personas estaban en la unidad de cuidados intensivos y 547 pacientes estaban en ventiladores. Si la gente quiere enterrar la cabeza en la arena y pensar que este virus no existe o no es tan malo, pueden hacerlo. Lo que no pueden hacer es arriesgar la salud de toda la gente en Illinois porque no usan máscara, no dejan de ir a eventos y fiestas y no sé hacer distancia socialmente. Nadie tiene derecho a poner en riesgo a otra persona a un virus mortal. Por favor, sea una persona noble y piensa en sus vecinos. Use una máscara, mantenga su distancia y lave las manos. Tus acciones afectan a todos. Vamos a seguir adelante. pero lo haremos juntos porque solos no podemos. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you, Dr. Ezike. Happy to take questions.
Can I
Yeah.
ask, just to clarify, and maybe this is Dr. Ezike, when you talk about the number of deaths, are these all here in Illinois, or are they any Illinois residents that live somewhere else that might have died, but you are recorded here? And I have a couple other
It's
questions.
based on the address. So if the address is an Illinois address, it will come to Illinois.
And do you have any idea how many might have actually died out of state?
How many people have died in other states?
Yeah, but they're listed as Illinois deaths.
It's very few.
Yeah.
I mean, I asked that question early on as well. It's very, very few.
And the models, are you going to release some more info, details of who is doing the modeling and where that is all coming from?
We can plan to maybe bring
I think
them
we've
or
actually made
share.
that-
They've
I
been
think-
here
I
before.
think that's been made public. UIUC, Northwestern, U of C, Argonne, thank you. And IDPH, I follow, IDPH being the lead, of course.
And of those in the hospital, are they today saying not just COVID, but probable COVID? Are they all part of that group?
Okay.
They get tested.
Right, so, so they're being tested there in the hospital. So you will have people that are getting their test, and then if they were not COVID, obviously they would come off the numbers. But yes, we have people who have suspected to have COVID and had that test pending. There's a backup even in the hospital to get those COVID tests, and so sometimes it's taking 2, 3, 4 days, but yes.
But
So
when you
Dr.
give us the
Ezike-
numbers, do you then go back and correct those numbers later? Because if we see, 8,000 and maybe it was really 7,000 because some weren't, or maybe it's 7,800, I don't know. But I'm just saying, do you go back and modify those numbers to the correct, how many?
They're
were?
modified, not necessarily
Daily.
on the day, but on a subsequent day.
Dr. Ezike, here's a good question. So, we know someone their son has a compound fracture, went to the hospital for that fracture, but then was tested, because they test everybody in the hospital, and has COVID. So the hospitalization, does it have him listed as a COVID hospitalization? Because he's not there because of COVID, he's there for something else. Because of Miami.
You checked into a room for an arm?
Yes.
Okay.
So, because the Miami Herald did a good job, they had 898 patients at Miami's public hospital, and they found out that only 471 were admitted for other reasons, not because of COVID, but they were there and now they have COVID. You see what I'm saying? Like, other people went to the emergency room for a heart attack or a stroke. Is there any way to pull that data out eventually?
So I guess I want to get to the point of, I'm not sure where the line of questioning is going. I think the point that we need to establish is that the number of COVIDs in the hospital, however you want to count it, has gone extremely up, and to the point where people who are coming in with a compound fracture might be sitting in the emergency room for days waiting to either be transferred to a place where there is a bed, another place, or waiting for someone in the hospital to be released before they can get in. And so that trend is what has disturbed us so much that we had to intensify the mitigations to make sure we can create a bed for anybody who, over Thanksgiving, over Hanukkah, over Christmas, might end up with a broken leg, might end up in a car accident, and now won't be able to get the care they need because there are no beds. And so we are trying to address that fact and looking for everyone's cooperation for that.
And those are very small numbers, what you're describing. You're picking very, very unusual circumstances. I'm just telling you, this is what we're getting from hospitals, that often, by the way, that people who are detected with COVID, they may show up for some other reason. They're detected with COVID, they end up going home, and then they end up coming back to the hospital too, and they end up as an overnight hospitalization. Yeah.
I know you.
Could you break down, and this might be for Dr. Ezike, the question about if COVID now being the third leading cause of death in Illinois behind heart disease and cancer. Earlier, I was speaking to a doctor who was actually telling me that there are parts of the country where it's become a leading cause of death, not in older populations, but in younger populations, 25 to 44. Can you tell me what it is here in Illinois? And I mean, are we seeing a trend in an increase in the number of deaths amongst younger people? Can you just break that down a little bit more?
I'll just say that sounds very unusual to me, to say that the younger population is
Right,
is
that's
the
what I'm
the
asking,
bulk
if
of
that's
the
the case
patients.
here.
That's not something we've seen.
No,
And actually, if
yeah.
somebody could pull up the slide back, if you don't mind, that has the death, because I think you'll see, by the way, that we had a time, keep going back, or whichever one has the death. There we go, that was it. It was the leading cause right here,
Right.
just so you know, and you can see went down to being the fifth leading cause, and then it's back up to third.
So we have, if you look at, whether you're looking at the first wave, the current wave, or looking at all of it, the highest number of fatalities have been in the 80 and over. The next highest have been in 70 and over, 60 and over. So we have deaths in every decile, every age group, but it definitely followed the pattern, 80 most, 70s, 60s, 50s, all the way down. But of course, the people who have died in their 20s and 30s and 40s and 50s, like those obviously are cutting the expected life expectancy by many more years because they are so much younger. But it's not that 20s make up more than 80s or anything like that, no.
Dr. Zike, could you?
Dr. Zike, with the hospitalization being a concern, what is the status of Metro South, the former Metro South Hospital, the former Sherman Hospital, and former Westlake Hospital? Maybe Sherman aside, because I understand the state gave that back to the owner, but with Metro South and Westlake, are they still ready to go? And are there, for COVID patients, and are there any plans right now to reopen them?
So we have done a lot of work on the hospitals, most of it on Metro South. That one is in what we call the warm state. If we gave the go-ahead and said we need to open it, within a couple of weeks, it would be ready to go. Obviously, it is not a full hospital. It was a former hospital. It's now what we're calling an alternate care facility. It's not going to have the full bells and whistles of a traditional hospital. We would always want the care of a patient, whether it's a COVID patient or any patient, to get the benefit of a full hospital with all the ancillary support and staff. And so we want to hold off on our alternate care facility until we are at that dire point where we're just completely full and then need to go to this alternate care facility as a place to offload patients who are improving, maybe only have a few days left of the hospitalization, and then we can move a patient there because there's, people in the emergency room waiting for a bed in the traditional hospital.
And that's the only alternate care facility that is kept in a warm state. Yeah.
One more for Dr. Zike. Could you please clarify, during this time when so many are looking for exercise and mental health, it's getting too cold to work out outside, the new rules, the tier 3 means small group classes. Even though they've done limited capacity, even though they do extra precautions and keep it clean and all of that, they are no longer able to operate. But you could go to a big gym. You could walk around the entire big gym and work out. Explain the difference. Why can't you go to a isolated class that is doing the social distancing?
No, and I understand, and I know that this impacts people who are using exercise for their mental health, and I understand that. I think the overarching theme and thought here is that we need to decrease the amount of gatherings. And so we have been saying that very clearly, as in just stay in your home, keep that as your group and not bring other groups to form a gathering. You can see that an enclosed space, a room where there's a fitness class indoors with multiple people, that's essentially a gathering. And so that is different from having a single individual on a single piece of equipment spaced out from another individual on another piece of equipment. So that's how we've made that. We definitely wanted to make health facilities available because of that, just both the medical health and the mental health, just as you stated. And so we were trying to, thread that needle behind keeping people at home, but limiting as much as possible the gatherings. But I understand that was the thinking.
And if you look at the Northwestern and Stanford study, if I may say, this became something of a debate, I think, among the doctors as well as a discussion with the industry, trying to make accommodation here, because doctors certainly believe that we ought to provide for people the opportunity to go work out for their mental health, but also just their physical well-being. And yet, when you look at the studies, there is more danger in fitness centers where people are perspiring. They're perspiring rather. They're exhaling quite a lot and inhaling, and so there's more danger. That's what the studies tend to show. And so there was a lot of discussion about that, and when it finally came back to me as a proposal, this was the effort to try to split the difference here and make it as low risk as possible, but leave it open for people.
As Is there
All right, this will be the last
Eric.
question, last question in the room.
Third day in a row of a positivity decline, very small decline, essentially flat. Hospitalizations and deaths obviously not reflected in that trend as well, but is there any cautious optimism at this point? We're starting to pump the brakes on this surge at all?
Eric, the news has been so bad for so long. And, you know, and you all know that I look at these numbers several times every morning and the night before I go to bed. So, yeah, this is, yes, there's a glimmer of optimism, I guess, is the right way to say it, in the idea. But I have been fooled before by the numbers. In other words, one of the reasons that we smooth the numbers out by doing a week's average, for example, is that, you know, we're trying hard to take into account that you can have a difference between a day when the labs are reporting a lot of reports and a day when some labs are offline. Sundays, some labs don't report Sunday numbers. They come back on Monday morning with those numbers, and they may not get reported till Tuesday as a result. So I have some optimism. I will say it's Wednesday. That means that many of the numbers that have came in on a Tuesday. That's better to me than a Saturday or a Sunday, just because, again, it's the vagaries of the commercial labs for the most part. Our labs in the state of Illinois are working pretty much nonstop and doing a terrific job. But, yeah, the numbers fluctuate a little bit. So, yes, I look at it in the morning, and I saw these numbers today. It's less than 10,000 cases, less than 9,000. In fact, today with 103,000 reported specimens. And that's a terrific number, but again, I don't want to draw any conclusions until we've seen more days.
All right, we've got questions online. John O'Connor at the AP. While there is backup space available, you have said the problem is staff, not space.
Yeah, that's right.
We hear other governors say staff is their problem too. What is Illinois' plan to find more staff if hospitalizations continue to rise? What steps are you taking now?
Look, John, I want to be clear. You can't just snap your fingers and find staff when the whole country is going through this COVID storm. There were times in the past, over the last 8 months, when certain states were doing better than other states, and therefore you could perhaps draw some staff from the states that were doing better. Now, really very few states, and certainly when you look at all the states in the Midwest, there's just, their hospitals are overflowing. Wisconsin has field hospitals operating, so it's very, very difficult to get new staff in. We've done a lot of what we needed to do to keep people licensed or get them relicensed if they retired in the spring, and so there are a number of those people who are available, but there is a limited number of staff people.
Jake Griffin at the Daily Herald for Dr. Ezike. How are things at long-term care facilities? Locations reporting an outbreak are up from the summer, but the number of cases are down. Does that mean we're better at containing it, or we're on the verge of a spike in cases by your estimation?
So I think I've said this before, it is very hard to keep any establishment COVID-free in the midst of a COVID storm. And so as rates go up in the communities, the staff that live in these communities, that go to work in these facilities, are falling victim to infection. We have seen, when we look specifically at the deaths of of the elderly people, we want to see, like, where are those deaths coming from? And so week over week, I look at those totals and see that for the people over 60, 1/3 of them are from the long-term care, but 2/3 are not in long-term care, which means they're from the community and got it from regular community spread. So I think we're continuing to do a good job with keeping those numbers so far down. You know, they were unfortunately ravaged in the spring. They were, despite all of our mitigation and efforts, even before we had a single case, they took a very hard toll. But we are doing a good job there. We're hoping that we can continue to keep those cases at a minimum because we have our most treasured individuals who are so highly susceptible. But I will say that if, those people they're frail and they're older and they often have poor outcomes, so that's why we're trying so hard to keep it out in the first place.
Dr.
We're doing a lot more testing of everybody, but staff in particular. Back in the spring, we only had a limited number of tests and couldn't test every staff person on a regular basis. Now we do.
Hannah Mizell is asking how many more state lab workers will be hired before the end of the year to speed up test processing times now that demand is way up. How many labs are being used now and how many shifts?
So we have, we have 3 labs, Chicago, Carbondale, and Springfield. They're working 7 days a week. Under my request and demand, I want them to observe holidays, so they will not be working on the state holidays. They will have Thanksgiving off. And so that is my call to say that these people who have been working tirelessly do need a break themselves. We are trying to look for qualified lab staff to come in so that we can have the shift run longer, that we can have even longer days. We're already 8 to 8 on most days. So that's essentially 2 shifts. But if we can find the appropriate qualified staff, we will be able to do more, especially for this acute surge that we're dealing with now.
This is a question from Bernie at the SJR on behalf of Doug Finke. What would trigger the state to go into a nearly virtual shutdown like we saw in the spring near the beginning of the pandemic?
Well, before I answer the question, let me just honor both Bernie and Doug for their many years of journalism, of serving us all by reporting from the Capitol. There's, I think, a lot of people who will miss them at the SJR, and those of us who read them on a regular basis. So we'll miss you doing the job that you had been doing. Don't know what your next plans are, but we're all rooting for you both. The trigger for new mitigations or more mitigations, I mean, look, I think you all understand that you've got to go through at least one and really 2 incubation periods after you put mitigations in place for you to really see whether those mitigations are having the desired effect. It's hard to tell when things are going up, and you start to see a little bit of a bend in that curve to say exactly whether the mitigations are working or not. If after 2 incubation periods you're just seeing a bend but you're still going up, we have to do more than that. I mean, frankly, we just can't have this continue at the trajectory that it's been on. We've got to flatten that curve. And so the triggers obviously will be if we get through at least 1 and likely 2 incubation periods and we're not seeing any movement in the right direction, that's when we'll have to consider what the next steps will be.
Dave McKinney at WBEZ. Would there be any public benefit to making COVID-19 vaccinations mandatory? And if so, is that something your administration is considering? Do you have existing authority to impose something like that through executive order?
That's not the current plan. Look, we believe that enough people will choose to get a vaccine when the vaccines are available that we'll get to a point where, and I hate using these words, but Dr. Ezekiel will probably correct me, but where we get to roughly herd immunity, that means at least 70%, Dr. Ezekiel, around 70% at least. We like to get it much higher. But we've never, considered yet whether it should be a mandatory vaccination for everybody.
Dave Dahl at WTAX. Not to diminish the seriousness of COVID, but this is certainly no time to enjoy being governor. Any second thoughts about the job, second term, etc.? How are you holding up?
Now, Dave, really? After all this, look, there's no doubt this job is a hard one. There are hard decisions that get made every day. I have a great team, so I'm lucky. In the process here, I think that we're serving Illinois well. But the sum and substance of my answer to you is that despite all of the difficulty here, and there clearly are a lot of challenges ahead, I do love the job, and I love serving the people of the state.
Jim Haggerty at the Rockford Advocate. Governor, can you respond to State Rep Joe Sosnowski's comments that there is no scientific data to support the Tier 3 restrictions and that new mitigations are only meant to install fear?
Well, let's see. I'll try to be kind here. If you do any reading at all, I think what you've seen is all of the scientific data, all of the scientific information that's available shows you that putting people in large numbers inside, not wearing masks, having packed groups of people with less airflow, so again, indoors, is not healthy with this virus. This virus travels. That's exactly when this virus wants to amplify. And so I don't know where he gets the information that he has. I mean, if he wants studies about every single location, that just hasn't been done yet. This virus is so new. We're 8 months in now, and there are lots of studies about indoor activities, and it is based upon the packing of people indoors in relatively small size rooms with large numbers of people, or just, overcapacity. That's what's causing the transmission for the most part. And I would say, just reminding him, I hope that he'll have a safe Thanksgiving and stay home with his family and not with outside families, or if you do, that people are isolating now so that they'll be safe when they come to your home.
Dr. Ezike, this is from Jamie Monks at the Tribune. On October 26th, you said the state was on the path to surpass 11,000 deaths by the end of the year. The state surpassed that milestone less than a month later. What does this indicate to you about the trajectory of the fall COVID resurgence?
It means we're in bad shape. It means we're in bad shape, and that is part of the reason that we had to take the steps that we've taken, because if we've exceeded all of our projections by more than 6 weeks, the numbers for the end of the year would just be untenable. And so I know that everybody has seen these numbers with us. I know many people have been reaching out saying, when are you going to do something? This is getting bad. So I think people generally understand that. That's why these mitigations are so important. But it's not just words on the paper. It has to be the uptake of the words by the people of Illinois. And so I need everybody's help talking to one another, saying, we really need to rethink Thanksgiving. We need to really rethink this party that you wanted to have. Maybe we can just put this off. We heard that the vaccine's coming. Maybe we should think about after we get the vaccine, and most of people have gotten a vaccine, then we'll just do it, some months later. I think that is our path to making sure that we don't continue to go past our 11 to 12 to 13 to 14. These are our family members. These are our coworkers. These are our loved ones that we are saying they may even be here now and won't see 2021. Let's all get to the point where we can get that vaccine, and then later in 2021, we will be able to get back to a lot of the things that we have dutifully sacrificed for now.
Mike Militich at Quincy will be our last question today. Viewers continue to ask for exact day of death reports. Some local health departments provide that data. Can you explain why IDPH may need to wait to add deaths from one day to the next?
So a coroner in a county will know the local health department lead and will call them up and say, you have another COVID death. By the time that information is put into the data systems, by the time the paperwork is filled out by the hospital, signed off by the doctors, and goes through our vital record system, all of those processes take time. So I don't get necessarily the report 6 hours later. It may go through, the bureaucracy and the different steps, and I might get it. So we are giving you the reports that we've gotten over the last 24 hours. They add up at the end, but we are probably getting it some days after the initial.
All right, thanks everyone.
Thank you.
Thank you.